I'm Dr. Rob Weiss. I'm an ear, nose, and throat doctor in Norwalk, Connecticut. Many of my patients have been asking, what is it like to undergo in-office balloon sinuplasty to treat the pain and pressure associated with chronic sinusitis? I've been in practice in Fairfield County over 13 years, and we seem to have a unique area in the sense that we have a mix of pollution, allergies, and probably some other factors that predispose to sinus infection and sinus problems. I've literally treated thousands of patients over the years with these sinus problems. Many of them had been seeking a solution for a long time. Up until a few years ago, patients that required surgery would have to go to the operating room and have general anesthesia to have this done. Now with the advent of balloon sinuplasty, we're able to do many of these cases in the office under local anesthesia. This has a lot of advantages for the patient. Number one, they're not going under anesthesia. The recovery time is much shorter, and their downtime and return to work or other activity time is much shorter as well. The sinuses are located in the bones of the skull and the face. On your right side, you'll see an infected sinus, noted by the thickened lining and the green discharge within the cavity. A catheter is introduced from which a lighted cable enters the sinus. This helps us locate the sinus, and we actually can see a bright light on the patient's cheek once we know we're in. After this is done, the balloon catheter is slid over this guide wire to be positioned within the sinus in the tight portion that needs to be dilated. Once the balloon is positioned, it's inflated, opening up the channel permanently by repositioning the bones that were too narrow. After this is accomplished, the balloon is retracted.
I had a lot of sinus headaches. I had congestion all the time, and any time that I ever got a slightest cold, it would end up a sinus infection. So it was very unpleasant. I had sinus infections probably every 2 or 3 months or so for a couple of years.
Aside from the headaches, I would have severe pains while I was flying in an airplane, which I did quite a bit with travel.
Believe it or not, we're done with that sinus.
All right.
Okay, how was that?
Not bad.
Not bad. Did you feel anything?
A little, like, pinprick at the top.
Right.
But then one crunch, but that was it.
The procedure itself was not very bad. I didn't have a lot of pain or discomfort during the procedure. I just felt pressure, but no pain. So the procedure itself actually was quite easy. The whole staff here is so warm and welcoming that you feel very comfortable. I would never have considered getting a surgery done in a doctor's office as opposed to a hospital prior to coming here. But I felt confident in Dr. Weiss and knew that he would steer me right.
The procedure itself was very simple, fast. There was no pain, so I feel it's, I wish every medical procedure that I required at 64 years old was as easy and as fast in terms of recovery as this was, because it was just, it was amazing.